Today, I have a really exciting episode for you. My guest, Dr. Dipnarine Maharaj, is an expert in and deals with stem cells, bone marrow transplants, but most importantly, this fascinating new study he's doing where he's injecting a younger person's blood into older people to try to rejuvenate their immune system and reduce their frailty and weakness. Very cool episode. Stay tuned. Dr. Maharaj, thank you for coming on the Anti-Aging Hacks show. What is your background and training in medicine?
Um, I trained initially as an internist and then subsequently as a hematologist, an oncologist, and a bone marrow transplant physician.
That's great. So how did you get into bone marrow transplants and dealing with cancer patients, of all things?
So my training, my initial training, my training as a doctor was in Scotland at the University of Glasgow. And I was very fortunate during my training to be selected to be able to join the bone marrow transplant program. It was at that time at the University of Glasgow, it was a pioneering program. It was one of the few bone marrow transplant programs worldwide. And what we were able to do was to do some of the pioneering work developing the field of what's called autologous bone marrow transplantation. Prior to that, the work that had been done in Seattle was using donor stem cells to be able to repair the immune system of patients with cancer, like blood cancers, leukemias, and other types of blood cancers. But we developed a system, process whereby we collected the stem cells from the patients who had achieved remission from their cancer. We froze those cells, and then we destroyed the bone marrow and reinfused the stem cells. And what we found was that when you reinfused the stem cells as they regenerated, they would actually repair the immune system of the patient. So that went on to become, we showed significant improvement in the survival of these patients with leukemia who would not have survived beyond probably about a year or so, but we had good 5-year disease-free survival. And that actually then pioneered the way for the field of autologous bone marrow transplantation, autologous peripheral blood stem cell transplantation as it exists today. And now it's a standard of care because it's done worldwide. But we studied that in more detail, and we showed that, in fact, the patients who are long-term survivors are the patients whose immune system recovers, whereas the patients whose immune system does not recover, their disease tends to recur. So the continuation of that work is that basically I have developed a number of ways to be able to help people who have cancer with their immune system. One of the things that we do is we say that people who potentially are at risk of cancer, we bank their immune system when they're healthy. For people who have developed abnormalities of their immune system, which we call immune dysfunction, we measure that precisely because immune dysfunction, or another term for it is immune senescence, which is essentially aging of the immune system, which begins to occur in individuals after the age of 40. In the majority of individuals, we call that normal aging. So that immune senescence, as it worsens, results in the appearance of different types of diseases. So cancer is one of those. The other one would be autoimmune diseases, another type of chronic inflammatory diseases. Examples of that would be diabetes, heart disease, Parkinsons, Alzheimer's. These are all examples of that. The other issue that can occur with this term immune senescence is recurrent infections. You have many people who have recurrent infections. And then the last one that it is associated with is just this syndrome we call frailty. Frailty is associated with aging, but it can occur on its own, and it's an indicator of aging of the immune system or immune senescence, or it can occur as a result of any of the other chronic diseases. So our approach with that is to measure the immune system and correct it. And then the third area we're working on with immune senescence is actually using the young blood study to be able to look to see if that could be a way to be able to correct that particular problem of immune senescence, particularly associated with frailty.
Great. That's a lot of stuff you just said. So I want to break that down. But I want to ask you a couple of leading questions before we get in. So you mentioned that the healthy immune system is so important, and I completely agree. I hear that in cancer patients, chemotherapy in particular weakens the immune system and it destroys those cells. So one option that I think some of you've pioneered with others is that using bone marrow transplantation after chemotherapy regenerates the immune system, and therefore now this patient that had cancer can fight back the cancer because of these new stem cells. The new bone marrow is rejuvenated. Am I imagining that right? And secondly, how is it that you draw the bone marrow from somebody? Are you injecting a long needle into their hip bone, or where do you get it from?
So to answer your first question, the question essentially, what does bone marrow transplant do? What does a bone marrow transplant do? A bone marrow transplant is really a way of taking the immune system from a healthy individual and replacing a diseased immune system in someone who has a major disorder like a cancer or leukemia or a blood disorder. So that's the standard of care, and that's a long and well-established procedure. The second question is basically, how do we obtain the stem cells for a bone marrow transplant? Well, that process has evolved. Previously, when I first started doing bone marrow transplants, we would actually take the patient to the operating room and we would extract the bone marrow using long needles, which we would inject into the hip bone. And these were multiple injections, very painful. And that's the reason why, and because of the volume that we had to remove of the number of stem cells and the volume of bone marrow we had to remove, it had to be done as a procedure in the operating room under a general anesthetic. Now, worldwide, that is still done in some places, but a new process which we were also involved in developing was the process of what we call stem cell mobilization, peripheral blood stem cell mobilization. Because we found that what you could do is give a certain protein which releases the stem cells from the bone marrow into the blood, and it would release enough stem cells that could actually be reinfused into a patient at the time of a bone marrow transplant and recover the immune system and the blood. So the more frequent way that it's done now is using this particular way. In fact, every year in worldwide, there are over 20,000 people, healthy individuals, who will actually undergo that process to be able to donate their stem cells to someone else who needs a transplant. One of the unique aspects of our program is we have a program where individuals whose immune systems are healthy, if they would like to bank some of their stem cells for the future, then they can do that. And we do the same process as if that the 20,000 people who worldwide will donate their stem cells to someone else. So I believe that this is a way that individuals who are at risk or who would like to actually have some of their cells collected and stored when they're healthy can do so, because it's very good to be able to do that for someone else, but I think we are allowing people to be able to do that for themselves so that these cells could be available for them at a later date.
That's great. Again, to somebody that's new to this field, all of this seems fascinating. I'm sure to you it's just another day in your life. But let's talk about the stem cell banking. I know there's been news recently with the FDA banning your stem cells from adipose tissue or from your fat cells because there's manipulation of those stem cells with either getting them from the blood or from your bone marrow. There is no such manipulation, and therefore these are still okay?
Yes, that's correct. the the reason why it is fine is that because these are stem cells which over the years, over many years, this procedure was basically proven that it actually it basically shows that and proven that it works. So whereas the problem with using fat stem cells is that there are still many areas of controversy, and the other aspect of it is that we don't really know if those fat stem cells actually will solve the problem of restoring the immune system. What we do know, which is one of the reasons why I'm very concerned about the use of fat stem cells and people storing stem cells, is that if you take if you take fat, otherwise known as adipose tissue, and you look at it, it actually is an immune organ. And so usually in areas where fat accumulates, if you study the environment of those fat stem cells, is that it is in an inflammatory environment. So if there's inflammation affecting the function of the stem cells, we also don't know if there are changes where there could be mutations occurring in those stem cells that could cause problems later on if they're injected back into someone. We do know that people who have inflammation, where their immune system is abnormal, and chronic inflammation is bad. The immune system, when it's working well, creates acute inflammation, but that acute inflammation actually goes down. And so chronic inflammation does not occur in a healthy individual. But in those individuals who have chronic inflammation, you can associate the chronic inflammation with different diseases. And so to be able to say to someone, well, we'll collect and store your fat stem cells, it's not proven the value of that long term.
Mm-hmm. Okay. A couple more items or definitions that I want to get out of the way. I believe there's 3 areas where we can extract adult human cell or adult stem cells from. It's the bone marrow, which we're doing, blood, as well as adipose fat that we discussed. And in particular, in the bone marrow, there are 2 different types of stem cell lines. It's the red bone marrow and the yellow bone marrow. And I believe these produce different stem cells as well. So what's the difference between the red bone marrow and the yellow bone marrow found in the bone marrow or the bone?
That's a nice description. In fact, when you look at bone, particularly the bones that are producing a lot of bone marrow stem cells, and you actually look at it the way a pathologist does, you will see red and yellow. The yellow really refers to the fat that's in the bone marrow, and the red is really relating to the stem cell, the cells that are producing a lot of blood. Now, if we go back and actually look at the cells within the bone marrow, there are 3 that are produced by the bone marrow. There are 3 different types of stem cells. There are mesenchymal stem cells, hematopoietic stem cells, and endothelial stem cells. So the fat will predominantly have will accumulate mesenchymal stem cells, but throughout the bone marrow, you have all of these 3 different types of stem cells, and it really is not possible to sort of look at the tissue, at eye level and say, okay, well, that's one particular type of stem cells are actually in the red area and another type in the white area. We really have to obtain the samples of the bone marrow and use very sophisticated markers on the surface of the cells that can tell us which type of stem cells there are.
Gotcha. And you mentioned immune senescence, Doc, and I want to come back to that. You said, I think over age 40 is when the immune system starts to decline. Do we know that this is the same process as the other senescent cells, or is there something special going on with their immune system?
So just to qualify that question, we have the immune system, which is in the bone marrow, but in other organs as well. But we also have every single tissue in the body has stem cells. It's just that the number of stem cells that's present in the bone marrow is actually significantly higher than any other organ in the body. And so what senescence really refers to is the fact that stem cells and immune senescence, and I'll come back to that, but let's talk about senescent cells. Senescent cells are really cells which have been exposed to some sort of toxin, like a virus or a heavy metal or some toxin, which basically has caused the cells to undergo, the DNA within the cells to acquire mutations or abnormal genes.
Mm-hmm.
What that triggers in the cell, it then triggers the cell to undergo a process of cell division. But when after about 50 divisions, that cell now stops dividing. And that's what we call a senescent cell. So senescent cells can exist in every organ of the body. And the bone marrow is also, can have a high number of these senescent cells because the bone marrow is a very active organ. And the stem cells are dividing on an ongoing basis to produce more red cells, white cells, platelets, B cells, T cells, natural killer cells. These are all the different types of cells that are being produced. So there's a high need for it. So the accumulation of these senescent cells that I've described tends to occur more frequently in organs where there's a high turnover of the cells.
Gotcha. And let's talk about frailty. You had mentioned frail individuals. How do we measure frailty in humans?
The measurement of frailty is really it involves using clinical parameters. So, for example, somebody measures high blood pressure using a machine. In the case of frailty, there are different parameters that are to be able to evaluate an individual's cognitive function, for example, their physical function, social functioning, and there are about eight of those sort of subgroups that we can look at to see how well an individual is determining their resiliency. Resilience is basically, if we're stressed, we can respond, we can react to that. But frailty is a measure of that ability. And so you typically look at individuals when they're frail and you say, okay, that person is frail. But what we're doing is measuring it in a more accurate way. How do we measure it? Well, there are scientists who have studied thousands of people and came up with certain parameters that allows us to be able to define an index. And that index has been validated by other scientists. So now the use of the word frailty has become well known in clinical circumstances as a means to be able to measure measure dysfunction or a deteriorating function of that individual. The correlation has occurred between measuring immune senescence, which is the senescence of the immune system, using specific markers of the immune system and correlating that with frailty. So someone who has immune senescence is more likely to get frailty. And so therefore you can extrapolate back that if somebody has immune senescence, therefore the likelihood of them getting frailty is increased. And so then we can measure this frailty index using, in our study, what we're doing is we're using 41 different parameters to be able to measure, to calculate an index, which we would then be able to use as a means to determine whether our treatment is actually helping that individual.
Yeah. A couple of weeks ago, you told me about the clinical trial that you're doing with transfusions of stem cells into older individuals. And when you told me about it, I was very intrigued. Can you tell the audience what you're doing?
Yes. So what we're doing is we have a clinical study, which, again, to sort of explain, we wanted to look at the effect of immune senescence and also the aging of the immune system. As I mentioned to you before, its effect on frailty. We know that it's correlated with frailty. But when you have an intervention that you want to study, you basically will then write a protocol. The intervention, I'll explain to you in a minute what that is. But what we did was we wrote our protocol, we submitted it for review by the FDA, and once we got what's called an investigational new drug application, we then submitted it to an IRB for approval. So that's the study I'm referring to. The study is basically looking at ameliorating frailty by treating individuals who qualify for the study or subjects who qualify for the study by giving them plasma which is obtained from young donor young donors who've had their stem cells mobilized, and we call that. So it's young blood stem cell mobilized plasma. That's essentially what we're using as our intervention.
Gotcha. So you're getting these stem cells through a protein to leave the bone marrow into the blood. You're drawing the blood out, extracting these stem cells, the immune stem cells, and then you're injecting them into older or frail individuals in the study and then measuring them over time to see how they do or how they improve. Okay.
We're asking young donors between the ages of 18 and 35. We mobilize their stem cells from the bone marrow. And what we do is we will take the plasma, not the stem cells.
Mm-hmm.
And we take the plasma, we collect the plasma, and we give that back to the aging individuals who satisfy the criteria for our clinical study.
I got you. And giving this plasma to the older individuals then rejuvenates them. It turns back their markers that now you're measuring. How many markers are you measuring to see a difference?
We're looking at over 100 markers. And again, to qualify what you just said, we don't know yet
mm-hmm.
if this study is going to work. What we're doing is, first of all, in this particular study, our primary objective is to look at safety, the safety of this particular stem cell mobilized young blood plasma being given back to subjects, between the ages of 55 and 95 in the study. So the first thing that the first objective is to determine, is it safe? The second objective is actually determine whether we can see evidence of efficacy. But the ideal way to do a study to look at efficacy is to do what's called a randomized study, where
mm-hmm.
we give one half of the subjects the treatment and the other half a placebo. So that's the reason why our study is still in what we call a phase 1, phase 2, because in a phase 1, phase 2, it's primarily looking at safety.
I gotcha. How often are you giving these older individuals the plasma infusions?
In our protocol, it's being given once a month for a year.
Mm-hmm. And then I assume you monitor these folks for a length of time. How long would that be?
Yes, we're monitoring the patients throughout. The study goes on over a 2-year period. So the first year, the subjects are actually getting the infusions. And then the second year, they're being monitored by having clinical assessments and tests done to look at the effects of what the treatment has done.
Okay. As you mentioned, efficacy of this treatment is extremely important. So that's a certain factor that you're measuring over everything else. Secondly, how do you, Dr. Maharaj, define success for this study? How, in your ideal scenario, what would happen to these individuals from 55 to 95? What kind of rejuvenation would they get from this plasma?
Well, I think the first thing we want to make sure that the first success is to determine that it's safe. The second would be this, as I say, the secondary outcome measures would be to be able to show that and our study is powered to be able to look to see if there's a certain reduction in the frailty index that we're studying. That would determine if there's evidence to suggest that this might be, it might be a useful treatment. But it would still need to go to the next phase, which would be a randomized study to compare the treatment with people who've received the treatment versus those who have not received the treatment.
Okay. The trial's obviously started. When did it start, and how many individuals do you have enrolled at the moment?
The study started in January of 2019, and we have a number of subjects, both donors, young donors, as well as actual subjects who are between the ages of 55 and 95 who are enrolled in the study.
And is the study completely funded?
No, the study is not funded. We have received some funding to be able to go ahead and get started, but we require the complete funding. The budget for the study is that it requires $10 million to be able to complete the study of this size and of this complexity. We have a foundation, the Stem Cell Cancer and Regenerative Medicine Research, Inc., that has, the board members have basically agreed to raise the funding to fund this study.
Okay. And I understand you're also looking for individual investors and or groups to donate money to the study so you can continue with this, correct?
Yes, we're looking at this moment. What we're doing is basically looking. We want to get the foundation funded so that we can do the study. The next step would be a determination once we've seen the results of the first phase. Then we would then have to see how we could then do the next part of the study.
Yeah. Assuming you could get the funding for the first phase, Dr. Maharaj, how long would the first phase last?
If we had the funding, if we had all the funding, we would be able to. I would estimate that we would be able to finish the study within the next 2 years.
Great. So if you are a wealthy individual or a group that invests in anti-aging or regenerative technologies, I would highly encourage you to look up Dr. Maharaj, and we'll share the information shortly, and donate to this very important study that he's doing. Now, Dr. Maharaj, is there anything else you want to talk about? I have a couple of other questions for you regarding your study.
No, I'm very happy to answer those questions.
Okay. One other question that I had related to a different startup that was trying to do plasma infusions from young blood to older individuals was called Ambrosia, and I believe they got shut down by the FDA because they weren't doing what you're doing. You're doing this the right way. You're going to FDA, establishing efficacy, and then looking at the frailty index as an intervention. They were making bold claims of making you younger, older people younger, just by plasma infusions, and charging a bunch of money for it. So, well, congratulations for doing that. How was it going through the FDA? Did it take a long time? Like, is it a laborious process?
It's a process that's required, and I think that one of the things that one has to be very clear about, and I think that this comes from my experience as a hematologist, because during my training as a hematologist, I also trained in blood banking, and so I've had a lot of experience in actually the administration of blood products to patients. And I think that the issue that with the company that you talked about is that they minimize the potential risk to patients of getting plasma transfusions. And I think that this is something which, again, we are following the requirements of the FDA. We're following the regulatory requirements because, again, it's a product which is coming from a different person. And every year there can be patients can die as a result of receiving blood products. And so we have to make sure that we study the safety of this before we can make any claims. And we've got to prove that it is using the defined criteria that is established by the FDA to tell us whether when you have a new product which you want to make, which you want to do study seriously, because the problem that we encounter, which is aging, is that we have a lot of people aging very quickly, and this problem of frailty is affecting huge numbers of people. I mean, if you look at the population, we've got, by the year 2050, we'll have 2 billion people over the age of 65. So if we want to do interventions and we want to help those people, we've got to do it in such a way that we do it the right way. And I feel that this is the reason why we chose, we have to do it, because the rules and the regulations requires us to do it that way. So we have to follow them.
Mm-hmm. So assuming, and I'm crossing my fingers for you, that you get funded for this phase, how long would the next phase last of this trial, of the study?
So again, with the funding, what we have to do is complete the study. Then we have to analyze the safety. We have to analyze outcome measures. That will allow us to then be able to design the next phase of the study. And we would then go back with that data to the FDA and basically show what we've been able to achieve and work with them to design the next phase of the study. So I can't really answer that question yet.
Okay.
But what I can say is that what we put together, we've defined it, we've defined the duration of time, that each person will be in the study, which will be 2 years. We also defined that the number of people who we need to complete, the number of donors as well. So these are all very well defined in the protocol that we currently have. And again, what we do need is we want to be able to get that done as soon as possible within the time frame we've set in the protocol. And so we're looking for the funding to be able to do that, and the foundation is raising the funds to do that.
Okay. And I'm going to future project a question, Dr. Maharaj. Assuming all of your trials and your studies are wildly successful, in 10 or 20 years, could we imagine ourselves going to the local Walgreens or a CVS starting at age 40 or 45 and get a booster every 3 to 4 months that would regenerate the immune system? And so we avoid the challenges of frailty early on before we get frail. Is that a possibility in your mind?
Yes, I believe that what we have to do is to be able to prevent what occurs with the diseases of aging. We've got to actually maintain our immune system healthy way before the changes begin to occur. Because if you look at the reason why I say that is if you look at those individuals who achieve healthy aging and healthy life extension, and they're living well into their 90s, 100s, and they're actually fully functional without frailty or any of the effects of chronic diseases, and you measure their immune system, what you find is that those individuals have a normal immune system. Now, with normal aging, as we've talked about before, it's usually after 40, but we're seeing many people with accelerated aging. And so there are other things that could be done that comes out of the frailty index that people could use to be able to look to see how quickly they're aging. For example, there was a study that was recently done looking at what's called gait speed. That's the ability of how quickly we walk. And that shows that in individuals who are in their 40s, if their gait speed is abnormal, it predicts for them actually getting diseases earlier. So I think that we've got to think. Your question is an excellent question, because we have to think proactively. That is, instead of waiting when our immune system begins to decline for over the next 20 years to then develop a disease, we've got to be proactive and say, okay, when we're in our early 40s, do something to maintain our immune system. And this is something that that individuals who come to see us, we measure their immune system. We look at look at that immune profile that those individuals who are healthily aging have, and we can actually help them to do things, modify their lifestyle, look at the environmental factors that they're being exposed to that could cause their accelerated decline of their immune system.
Great. When do you think we're going to get to that place? Is it a near term goal? Are we talking 5 to 10 years, or is this still much longer term?
No, I'm very optimistic. I think we have experience of people doing that right now. I mean, I'm one of the things that being so knowledgeable about the immune system, I started, I've been practicing those things myself to be able to maintain my immune system. So I think it's there. I think my goal is to be able to educate, and thank you for the opportunity to share with individuals who are interested in health, the various things that we can do now, because I don't think it's a question of waiting for the technology to evolve for 20 years from now. We've got to look at it right now, and the technology is there. We have to do the studies to prove that, but on the other hand, there are many things that people could do right now to delay the changes of the immune system that causes immune senescence and therefore chronic diseases.
Well, you touched on it, so I'm going to ask the question: what can people do right now to delay the immune system senescence and delay diseases?
Yeah, that's a very good question, because if you look at the factors that affects the immune system adversely, well, first of all, about 10% of individuals, they carry genetics. So they will have genes that are associated with accelerated aging, but they don't need to necessarily do testing to do that. They just look at their family history. That's often a very good indicator. The other things that we do know that affects the immune system are, for example, heavy metals. So people who are exposed to, for example, mercury, and mercury, if they're eating a lot of fish, as an example, mercury levels tend to be very high in large fish. So that's one factor that many people are not aware of. We also know about the effect of micronutrients which are necessary. We know a lot about calories, those are macronutrients, but micronutrients affects the function of the cells of the immune system. The gut microbiome is an also area where there's intensive study that's been done. There is the question of infections, people being exposed to more infections, their immune systems can be damaged earlier. For example, people who've been exposed to the Lyme's bacteria, for example, often when you look at their immune system, it's abnormal. The other things that we think about also that can affect us is exposure to, lack of sleep, lack of exercise, stress, vitamin D levels often. Vitamin D is not a vitamin, it's a hormone, which affects the immune system as well. Other toxins like exposure to alcohol, and we could keep naming toxins, but I'll just use that because it's a common one. So these are some of the things that we know that definitely can affect the immune system. I'll throw this in because this is another one which we have to think about in our travels, and that is we see more and more people thinking about going into space. If you look at the astronauts who go into space and you look at their immune systems, often it can be abnormal. And if you look also at pilots who go back and forth on long flights and airline staff, their immune systems can also be affected by that as well because of the higher incidence of skin cancers that they tend to get.
Because of the exposure to the sun at those altitudes where there's not enough protection as the sun rays travel through the atmosphere, probably. Dr. Maharaj, as somebody that's a leader in the anti-aging and longevity space, you've listed a whole set of things we could do to improve the immune system, and the studies you're doing are very fascinating. Are there any other one or two tips or anti-aging hacks for the audience that we can incorporate in our life today to make sure we are not frail, we are healthy into our later years? What would those be, if there's anything else?
Yes, no, I'll touch upon stress again, because I think stress is something which people don't recognize. But in my experience of treating patients with cancer, usually what we have found is that if those individuals who do come to see me, when you talk to them about what effects of stress has been, usually it's a prolonged stress. Acute stress is necessary, but it's prolonged stress, just like chronic inflammation is bad, so is prolonged stress, because it does lead to chronic inflammation. But I think in our modern lifestyle, we're very engaged with our appliances, our iPhones or our iPads, etc. And I think that worries me, because I think that the addiction that can develop as a result of that will create damage to our immune system because of all the different effects that it has.
Okay. One last question for you. Because you're in this field, would you recommend when babies are born to bank their umbilical cord blood and stem cells for future use? And second follow-on question is, if you haven't done that as a baby, as an adult, is now the time for you to start banking your adult stem cells for future use should you need it?
So I'll answer the question by saying that the need for people to have stem cells for a later date, really the best type of stem cells to have are the stem cells that when they're adults. And that is usually, again, we talked about the immune system between the ages of 18 and 35. In my opinion, that's the best time to actually have stem cells taken and collected, because when we're collecting the stem cells, we're not just collecting stem cells, we're collecting cells of the immune system. And the issue comes back down to if at a later date, and this is particularly applies to ethnic minorities, because at a later date, if a blood or an immune disorder occurs, and that individual needs a donor to have a transplant, which is a life-saving procedure, many times they cannot find these donors. And so I think it's really, and that applies to really the whole the population as a whole. But so I think that in my opinion as a transplant physician, looking at the immune system, looking at the way that the immune system forms, that to me is the best way to do it. And that's one of the reasons why we have this program in place. So we also collect cord blood stem cells, but the cord blood stem cells, there are a number of limitations, and that is that, first of all, the volume, the numbers of stem cells per mil of blood is high in cord blood, but the volume of cord blood that we can collect is small. And usually, if someone needs those stem cells for a transplant, when the child is over 10, there may not be enough stem cells. And so you often have to go and identify other donors so you could add that to the volume. So there are limitations of the collecting the cord blood stem cells, but nevertheless it's done, and it still is a valuable resource to have for the baby for later use, especially with newer technologies coming out, which is still unproven, but there is the technology of gene editing, etc. So I think that many mothers like to do that as a form of insurance, and I see that, again, the main reason for doing it is to collect it for the baby, but there are the limitations of volume, as I said. Whereas if somebody has their stem cells collected when they're an adult, especially a young adult, usually we're able to get enough stem cells that if they needed to have it for a transplant procedure later, there are enough stem cells there that they wouldn't need to get somebody else's.
Great. Dr. Maharaj, where can the audience find you online? And if people want to donate, how do they donate to your study?
So to find me, our institute is called the Maharaj Institute of Immune Regenerative Medicine, and we can be found online. To donate for the study, the foundation is called Stem Cell Cancer and Regenerative Medicine Research, Inc. It's online as well, so if they just search for that, then they would be able to find the foundation, which has their website and also donation pages as well.
Great. Well, thank you so much for coming on the show. This has been a really cool conversation.
Well, thank you. I appreciate you having me, and I have to say that the questions that you've asked me are really to the point, and I enjoyed chatting with you about it.
Great.